Hello everyone. Welcome to our channel Vitality Vision, where we provide valuable insights into various health topics. Today, we're discussing a condition that affects many men worldwide, erectile dysfunction, or ED. We'll explore several treatment options, including medications, surgical procedures, exercise, and more. Let's dive into the different ways to manage and treat ED. But first, please like, share, and subscribe to Vitality Vision for more health and wellness insights. Medications. One of the most common and effective treatments for ED is medication. According to the National Institute of Diabetes and Digestive and Kidney Diseases, doctors can prescribe several drugs to help individuals maintain an erection. Before we move on, please note that the information provided in this video is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have seen or heard in this video. The creators of this video do not endorse any specific product, service, or treatment mentioned. Reliance on any information provided in this video is solely at your own risk. Sildenafil, also known as Viagra, is taken an hour before sexual activity. It can be taken with or without food, but it may take longer to work after a high-fat meal. But be aware of the side effects, including headaches, flushing, indigestion, nasal congestion, dizziness, and visual disturbances. More serious risks, though rare, include priapism, a prolonged painful erection, sudden hearing loss, and vision loss, all requiring immediate medical attention. Drug interactions are another concern. Viagra can dangerously interact with nitrates, used for chest pain, and some blood pressure medications, potentially causing a severe drop in blood pressure. It is also unsuitable for men with certain health conditions, such as severe heart or liver problems, recent strokes or heart attacks, and specific inherited eye diseases. Viagra provides only a temporary fix, with effects lasting 4 to 5 hours, necessitating pre-planned sexual activity. This, coupled with its high cost and potential for psychological dependence, can be limiting. Additionally, lifestyle factors like alcohol consumption can reduce its effectiveness and increase side effects. Cialis, or tadalafil, is a common treatment for erectile dysfunction, ED. It's taken 30 minutes before sex, but only once a day, but it has several drawbacks to consider. Firstly, side effects include headaches, indigestion, back pain, muscle aches, flushing, and nasal congestion. While these are typically mild, they can be uncomfortable. Serious risks, though rare, include priapism, a prolonged painful erection, sudden hearing loss, and vision loss, which require immediate medical attention. Cialis can also interact with other medications, particularly nitrates, used for chest pain, and some blood pressure medications, leading to dangerous drops in blood pressure. Men with certain health conditions, such as severe heart or liver problems, recent strokes or heart attacks, and specific inherited eye diseases, should avoid using Cialis. Unlike Viagra, Cialis can last up to 36 hours, which provides more spontaneity but can also lead to prolonged side effects. Its high cost, especially without insurance, is another downside. Psychological dependence can develop, affecting sexual confidence without the medication. Lifestyle factors, such as alcohol consumption, can impact Cialis's effectiveness and increase side effects. In summary, while Cialis offers benefits, its side effects, serious risks, drug interactions, long duration, high cost, potential for dependence, and lifestyle restrictions should be carefully evaluated with a healthcare professional. Vardenafil, known as Levitra, dissolves in the mouth, so there's no need for water. It's taken an hour before sexual intercourse. However, it has several potential drawbacks to consider. Common side effects of Levitra include headaches, flushing, stuffy or runny nose, indigestion, and dizziness. These side effects are generally mild but can be bothersome. Serious risks, though rare, include priapism, a prolonged painful erection, sudden hearing loss, and vision loss, which require immediate medical attention. Levitra can interact with other medications, particularly nitrates, used for chest pain, and some blood pressure medications, leading to dangerous drops in blood pressure. It is also unsuitable for men with certain health conditions, such as severe heart or liver problems, recent strokes or heart attacks, and specific inherited eye diseases. Levitra provides a temporary solution to ED, with effects lasting about 4 to 5 hours. This requires pre-planned sexual activity, which can be inconvenient. Additionally, Levitra can also be expensive, if not covered by insurance. Psychological dependence on Levitra can develop, affecting sexual confidence without the medication. Lifestyle factors, such as alcohol consumption, can impact its effectiveness and increase the likelihood of experiencing side effects. Always consult with your healthcare provider to understand the risks and benefits of these medications. Surgery. For some individuals, surgical procedures may be necessary. The National Institute of Diabetes and Digestive and Kidney Diseases, NIDK for short, mentions 2 main surgical options. First, implantation or prostheses, which includes inflatable implants to make the penis appear longer and malleable implants to adjust penile position. Second, reconstruction, which is recommended for individuals under 30 and repairs arteries to maintain an erection. Exercise. Regular exercise can significantly help manage ED symptoms. A 2018 study suggests that 160 minutes of weekly exercise over 6 months can reduce erectile problems, especially those related to obesity, hypertension, and cardiovascular diseases. Additionally, pelvic floor muscle training, quitting smoking, and following a healthy diet can improve erectile function. Vacuum pump. Various tools and equipment are available to assist those with ED. Penis pumps, for example, can support erections without medication. These devices create a vacuum around the penis, drawing blood into it and helping to maintain an erection. Herbal products. Many herbal or all-natural products claim to treat ED. However, it's essential to exercise caution. The Food and Drug Administration, FDA, has found that many of these products contain undisclosed ingredients or excessively high dosages, which can be ineffective or dangerous. Always consult a healthcare provider before trying any herbal remedies. Conclusion. Treating erectile dysfunction requires a comprehensive approach tailored to the individual's needs. From medications and surgery to exercise and specialized equipment, there are various options available. Remember, it's crucial to consult a healthcare provider to determine the best treatment plan for you. Thanks for watching, everyone. If you found this video helpful, make sure to give it a thumbs up and hit that subscribe button for more content on holistic wellness. Don't forget to click the bell icon so you never miss an update. Share your thoughts in the comments below, and let me know what topics you'd like to see next. Stay healthy, stay informed, and see you in the next video.